So a device that can measure tremor frequency and amplitude, how could that be useful?
Well, you know, there are many kinds of tremor. I think we all have a degree of physiological tremor. There's a variation in when we hold our hands up, especially after tea or coffee.
Yeah.
You may get a little bit. So there is a system in the brain, maybe multiple systems, that reduce those kind of tremors. So maybe a disorder of that control system, if it's off a half a cycle, may instead of reducing actually increase tremors. And you know, people who are anxious will have tremors, and people who are cold will shiver and have a tremor. So it would be very important, because you have to know what kind of tremor a patient has to treat them correctly. So, especially at the beginning, when we're not clear what kind of a tremor it is, you know, people come in and they don't have the tremor that day. And they still have, so I asked them to take a video of it. And we would love to have a device that would give us the frequency and the amplitude of the tremor, and then what plane is it in? Is it in the axis of where they're going? Is it perpendicular to that axis? Or is it circular? And some people don't know the difference between a tremor, which is, you know, an alternating contraction of an agonist with the contraction of an antagonist, as opposed to asterixis, which is only one direction, but then you stop that action involuntarily. And there's ataxia, which is totally different. If you can characterize it that way, you can tell the difference between dyskinesias, and which are usually slower, tend to be more proximal, and tremors tend to be a little bit more distal and have different rates for sure, even though there's a variation. So patients don't know the difference between a chorea, then they need less medicine at that time and not more. And you know, many of them will take medicine because they think that's a tremor. And so we need to help them understand what they have and give them directions. Besides just, if we find out, you know, really it's only 5% of the time you're having a tremor, but it's when they need to use their hands that it bothers them. So we get a better quantification.
We talked about, you know, control earlier in some other regards, and is this sort of a device, if it was, let's say, built in your watch or built in your iPhone, that you could see what your tremor frequency amplitude is, or it's present or not, would that be something useful for a patient to have or own?
I think if they're having a tremor, particularly, we should be able to measure it. And in the office, we can't always do that. And, you know, when people are in our clinics, they don't have a tremor until they get up and walk. And then we see the tremor. And then we have a better idea. So, particularly important if it comes and goes. It would be very important when it does happen, how fast is it? And then if you use a medication or some other therapy, are you really helping it or not?
In the old days, patients used to just go to the doctor, and doctor will tell them what's going on, and then they come back home and they just have to wait to go to the doctor. But these days it's changing, where patients are becoming almost like a self-physician. They have a blood pressure monitoring machine, they have a blood sugar measurement machine, a pulse oximetry, a sleep monitors, this and that. So if you were a patient with tremor, would you want to have a device that can tell that, you know, when your tremor is present with a beep or an alarm, or when is it severe, or what's the amplitude, or what's the frequency, and things like that?
I think you have to be your own advocate. You have to be the one that is more concerned. The patient should be more concerned than the doctor is concerned. The doctor should be very concerned, but it's the patient that lives the illness, and we don't. So the patient is like electricity. I want to know a little bit about wiring so I can fix little things. The more I know, the more I understand. And the same thing is true of patients. I encourage them to take their blood pressures.
You also talk about athlete and coach. Tell me about that example, the patient in their control?
The old idea is you're the patient, you come in very humbly and you say, Doctor, Guru, what is it that I have? And I'm only a lowly patient. You tell me what I should do and I'll do it. Well, that doesn't work. I think we need to have the patient see himself or herself as the athlete. You're the one running the race of your life. It's your illness. You should be engaged in figuring it out and finding better ways to take care of it. So I want a patient to be active and ask me, if you were me, what would you do? That's the best question. And so I need them to tell me when it bothers them. I need them to know as much as they can. They can't come in and say, I shake sometimes, what should I do? I'll do anything you say. You know, that isn't very good. If you can't tell me what's wrong and when it happens, then I can't help you. And, you know, patients come in and they want to tell me the story of what the first doctor thought and why he was wrong, and then what the second doctor thought and why he was wrong. I say, no, I don't care about any of that. Just tell me what you noticed. When did it first start? And, you know, they look at each other and they never think of these things. So that's what we need. We need like Sherlock Holmes, we need to know the facts, and we need to know what makes it better, what makes it worse. So we're the coaches. We can tell them, I'm your personal trainer, but you have to do the work. Sometimes I joke with them and say, you do all the work, you get healthy, you get better, and I'll take the credit. You know, and then they laugh like, that's not fair, but you know, honestly, if that's what it takes for them to take ownership of their problem, then we're working as a team. Then they can do better. And some people don't get it and won't do that, but the ones that do, well, you know, the 86-year-old ladies that walk like they're 20 years old, and they're very positive and they're getting better with time on minimal therapy. So the idea that if they have a little bit worse tremor, well, if it's anxiety, we don't give more pills for Parkinson's for that. If it's because you're worried and not sleeping, or there's another illness, or somebody in the family is very sick, we can't fix that kind of tremor. So we have to know the patient, we have to know the situation, and without them taking charge of it, we can't, we're very limited. So having a device that can tell us quantitatively what's going on, we may find it's just in the morning before the pills work. Well, of course. Or it's just at the very end of the time the pills are taken before the next dose that it happens. Well, then it's obvious, but people don't always pay attention. Am I giving you